Medical education is rapidly evolving with modern educational technologies transforming how future healthcare professionals are trained. These tools, from e-learning to virtual reality, enhance engagement, improve accessibility, and better prepare students for clinical scenarios. This video will cover the history and challenges in medical education, explore concepts like AI, machine learning, and generative AI, and discuss blended and immersive learning models. Challenges in medical education in developing countries include infrastructure limitations, resource constraints, and connectivity challenges. These issues limit access to modern tools and advanced training facilities. This slide uses the term Code Blue to introduce blended learning as a critical solution. To overcome infrastructure and access barriers, strategies include offline learning, low-bandwidth solutions, and a mobile-first approach. Community collaboration can also help improve infrastructure and access. The blended learning landscape relies on key elements such as readiness, a learning management system or LMS, content, management, and the learner and faculty themselves. E-learning platforms include LMS, which centralize course content and tracking. MOOCs offer accessible, high-quality medical courses. Micro-credentials, such as digital badges, supplement traditional degrees for specialized skills. Learning blocks structure content delivery. They move from introductions and common challenges to examples, practice, and assessments. The structure concludes with reporting and record keeping and a summary. Technology is defined as the convergence of pedagogy, technology, and content to transform learning. This concept is learner-focused in the use of technology. Gagnet's 9 events of instruction offer a framework for designing effective learning. These steps include gaining attention, informing learning outcomes, stimulating recall, presenting content, providing guidance, facilitating activities, assessing learning, providing feedback, and enhancing retention. This slide points to Bloom's digital taxonomy and includes a link to a blog post. This slide references a presentation on Uber University learning paradigms in flexible learning. Current trends in AI-enabled technology-enhanced learning include increased personalization, virtual patients, adaptive learning, chat-based learning, augmented textbooks, and game-based learning. Digital learning platforms offer interactive courses with multimedia, quizzes, and simulations. They also support virtual classrooms for live lectures and adaptive assessments personalized to student performance. Adaptive learning utilizes personalized pathways and continuous assessment, adapting to individual strengths. Real-time feedback and actionable analytics help optimize instructional methods in curriculum design. Digital resources are abundant, including videos, e-portfolios, e-books, open access resources, online databases, e-journals, micro-credentials, and social media. They also include centralized repositories, examination databases, and question banks. Mobile apps for medical education include anatomy visualizers, drug databases, and clinical decision support tools. These tools offer interactive 3D models, medication references, and AI-powered diagnostic assistance. Online collaboration and knowledge sharing take place through virtual classrooms, collaborative workspaces, and social learning networks. These facilitate real-time discussions, project planning, and peer support. This slide introduces the concept of immersive learning, which often uses technologies like VR and AR to create engaging educational environments. Machine learning enables real-time diagnostic skill assessment. AI uses pattern recognition to improve accuracy, provides objective skill evaluation, and delivers personalized feedback for student improvement. The Virtual Medical Clinic, or VMC, is an initiative simulating a real-world medical museum using virtual reality. The VMC imitates physical environments for easy student navigation and exploration. The B-side, Teaching with Authentic Scenario protocol, involves introducing a case, detailing history and examination instructions, and providing investigation details. Management debriefing includes student summaries and supervisor sharing, followed by feedback and reflection. Augmented and virtual reality are key in simulation-based training. They enable immersive anatomical visualization, realistic procedural simulations for practice, and collaborative training for developing teamwork skills. Simulation-based learning utilizes high-fidelity and procedural patient simulators. This technology allows students to practice techniques and improve patient safety. This slide includes the term introduction. This slide refers to large language models, or LLMs. Small language models, or SLMs, assist healthcare professionals with information retrieval, summarization of medical literature, and staying updated with clinical guidelines. They also improve decision-making, patient care, and training simulations while addressing data privacy. This slide links to a resource from the medical futurist. This slide links to a resource from the medical futurist. Modern educational technologies offer benefits like enhanced engagement through interactive tools and improved accessibility via online platforms. They better prepare students for real-world scenarios using high-fidelity simulations and VR training. Challenges include high implementation costs for hardware and software, and the need for comprehensive faculty training and adaptation. It is important to balance new technology with traditional teaching methods for a well-rounded education. Future trends include the integration of advanced emerging technologies, such as holographic displays and AI-powered assistants. We expect comprehensive integration of multiple technologies to create more personalized and effective learning experiences, driven by continuous innovation. In Harvard University, modern educational technologies are transforming medical education by enhancing engagement, improving accessibility, and better preparing students. Continued innovation will shape the future of healthcare training. This slide lists references related to e-learning, high-fidelity medical simulations, and the effects of simulation games on clinical cognitive skills and motivation in medical education.
This slide includes a link to a resource regarding blended and flipped learning case studies in Malaysian higher education institutions. This slide links to Merlot, a program that provides curated online learning and teaching materials and promotes collaboration among educators. This slide links to Oasis, a collection of open access resources for education. The key takeaway is that pedagogy, or the method and practice of teaching, should always be the driver behind the adoption and use of new educational technologies.